In Ayurveda, this griva stump or the stiffness of this neck is explained as it happens in this area because of Vata imbalance. Because the Vata got imbalance, and we know the whenever Vata got imbalance, the main feature that disease has happened because of Vata is pain. So this area becomes stiff because of aggravation of Vata. As we know, Vata has also a property of dryness. It also causes degeneration because as our age advances, as we start going older and older, it's a natural tendency of the body that Vata in our body start increasing, which causes degeneration in the body, because it's a natural process. It is not like we can do something about it, but definitely we can delay it by using Ayurveda and yoga. How you can recognize it, maybe it is grievous thumb or cervical spondylosis, is because of two reasons. Whenever you flex your neck like this, like whenever you look down, your neck pain, whenever you take your neck back, then again your neck feels pain, mild pain, but you will start feeling pain. That is the main symptom of grievous thumb. But if there is advanced stages of cervical spondylosis, it can also called vertigo, in which a person feel like dizzy, and sometimes he faint also, all the time his head is moving. So this is also one of the symptoms that is related with cervical spondylosis, but it is in advanced stage. This kind of symptom do not come in the very beginning, but if you ignore the very previous symptoms of this cervical spondylosis disease, then maybe these kind of symptoms will also start developing. That's why whenever you feel there is stiffness in the neck or there is pain in this movement of your neck, it is high time that you start taking precautions so that you don't land up into any acute stage or any complication of cervical spondylosis. Because if it is in very initial stages, it can be reversed. It can be bring into normal health, but just you need to take some precautions and some preventive measures. Sometimes it also has been seen like there is a inflammation in the neck area little bit, not too much, but little bit inflammation also comes, and sometimes there is very coarse crepitations kind of sound, like tuck tuck sounds also, these kind of sounds comes. That also happens not in all cervical spondylosis or grievous thumb cases, but in some cases it also happens. That shows like there is a imbalance of Vata dosha. In Ayurveda, it also has been explained like whenever somebody is sleeping during day, and especially on high pillow, and most of the times it has been seen like people are thinking something, because this today's world is very thinking, and whenever we think about something, we just keep our eyes up and we lie down on a high pillow and we keep thinking for hours like this, in this posture, in supine posture, and that can also aggravate Vata, and it can make your neck stiff. And many times it happens like people could not recognize, like immediately all of a sudden this pain in neck happens from where. So one of the reason is you are taking very high pillow, even during daytime. If you are lying down, you are in the resting posture, but some thought stuck in mind and you keep thinking something for long hours, that can also disturb the Vata dosha, and not your thinking but that posture, and ultimately it can lead to grievous thumb or pain in your neck. In this kind of situations, most of the times the condition come as acute cervical spondylosis. Sudden shooting pain appears in your neck. So whenever this kind of pain appears, it's best thing that you visit hospital, because whenever the condition is acute means severe pain, and that time you need some anti-inflammatory whenever the situation is acute. So it is best, don't take self medication, always go and visit hospital, take doctor's advice, because in these conditions they know much better than you, because they have studied it and they have practiced it. So it is very important that whenever this kind of acute situation come, you please visit doctor, your nearby hospital. He can suggest you, he can give you some anti-inflammatories, and later there are ways and methods which you can do to prevent it, so that this situation does not happen to you again. So this was about acute condition, like all of the sudden a lot of pain happened. But there is another kind of cervical spondylosis in which the symptoms are very mild and very mild pain with no complication, and just little pain start happening. And even even with this pain also you need to visit doctor and you make your diagnosis whether it is cervical spondylosis or this pain is because of some other reason. It is very important to have a right diagnosis, because just because somebody has pain and if they are thinking of pain means cervical spondylosis, it's not true. This pain in the neck can be of many reasons, there can be many reasons behind it. That's why in medicine profession or in Ayurveda also a lot of importance has been given to diagnosis of a disease. Many people have this misconception like in Ayurveda no need diagnosis of a disease. In addition to that, there is another treatment in Ayurveda that is called Griva Vasti, but this treatment should be done in the presence of an Ayurveda doctor, and that too experienced Ayurveda doctor, so that he or she will be able to locate your point, only then it will be effective. So, this is one thing. In addition to that, there are various rasayans and various herbal medicines that will help to get rid of this pain, but these rasayans can also be prescribed only after proper Ayurveda consultation. So, the only thing that you can do for now from Ayurveda perspective, you can take some hot water bottle and hot pad, and you can just put on your neck like this, but don't just keep it like this, you just put and take it back, put and take it back, put and take it back, so that it will not cause any kind of boil or any kind of burning sensation in the skin. At the same time, if you are feeling vertigo because of cervical spondylosis, vertigo means like this, if you are feeling like this, then it is don't sit at home, it is the high time that you go and visit hospital and take proper treatment, because it is not good to ignore these diseases. It is not like something life threatening disease, but why to complicate it? Just try to take precautions as early as possible, that is best for you. At the same time, you can also use the Vata satiating diet, in which include what a Vata person should do, what a Vata person should not do. There is a link below what kind of diet a Vata person should eat. So, you can shift to that kind of diet or do's and don'ts that are mentioned for a Vata person. You can also apply all these do's and don'ts for this disease. For example, don't keep yourself awake at night for long, because that disturbs the Vata dosh. Try to have dinner on time, that is around 6 o'clock. Don't take late dinners. Don't take water immediately after food, because that also aggravates Vata. In addition to that, try to have organic, healthy and cooked food, freshly cooked food. Try to consume it within 3 hours of cooking. While you are eating, try to eat very silently. Don't talk or discuss any topic while you are having food. So, these are the simple things that you can do to reduce your Vata. So, that is all for today regarding this cervical spondylosis. If you have any questions, any queries, you please write down to us. I will try to answer your questions in the best possible way. And if you have not subscribed our channels, you are watching me for the first time, please take a second, hit the bell icon and click the subscribe button, so that you stay in tune with us for our upcoming videos. So, that is all for today. Thank you so much for watching. So, with this note, I would like to say stay healthy, stay blessed, take care, and don't forget to write to us if you have any queries. Bye.